and foster interdisciplinary thinking. Our mission is to fill that gap and to create a curiosity through different lenses, tapping the passion that guided the historical figures in medicine and bringing present-day groundbreaking research to the front lines. We interview physicians and leaders in the industry about present-day healthcare challenges on our live programming.
I'm Dr. Sophia Yen, and I will be speaking about birth control update, hashtag periods optional, BMI, race, and age, and we'll throw in some acne slides at the end for fun because Ramana asked for it. So if you could go to the next slide, that would be great. Yeah, great. So first of all, everybody should know all of their birth control options here. I've listed it from most effective to least effective. I think many of you will be surprised to learn that the implant beats vasectomy, and the vasectomy is the gold standard. But as you can see in the light blue on the right, the vasectomy fails 0.15% of the time, whereas the implant only fails 0.05% of the time. Then comes the IUD with hormone, which fails 0.2% of the time. And then comes tubal ligation. So a hormonal IUD beats tubal ligation. And then comes the copper IUD, then comes the shot. The ring, the patch, the pill are all put equal, but we've shown that when you're actually using it, the ring has a slightly better efficacy than the patch, slightly better efficacy than the pill. And the main reason for that is the ring, you have 12 times a year where you can mess up. The patch, you have 52 times a year where you can mess up. And the pill, you have 365 times a year that you can make a mistake there. The diaphragm is about 12% failure, and that's assuming you use spermicide and that you use it correctly, that you leave it in, that you reapply the spermicide with every sexual intercourse. The male condom, as you can see, has an 18% failure. The female condom has a 21% failure. All of this beating withdrawal. And then there's fertility awareness methods as well at 24%. And then spermicide with a 1 in 3 chance of failure because it's just there to kind of kill sperm. But as you know, every ejaculation, there's about 200 million sperm coming out very, very, very fast. So in order for the spermicide to kill it all, it has to be in the right place and it has to cover all of the sperm that runs through. So that probably explains why it fails 28% of the time. If you could go to the next slide. So teaching you today, the talk is birth control update. What's new? I like to say what's new, but not necessarily better. But this one is actually better, but it's just very expensive. And from a cost effectiveness perspective, I don't know if insurances should be paying for this when you have other options that are less expensive, but it's all relative and it's whatever works for you. So generally when we see POP, progesterone-only pill, as doctors, we make the joke, what do you call a woman on a POP, a progesterone-only pill? You call her mama or pregnant. And the reason why is with a normal progesterone-only pill, it's usually norethindrone-only pill, if you take it late by 3 hours, then it's not going to work and you're going to need some emergency contraception if you had sex within the past 5 days, and you have to wait 2 or 3 days for the hormones to get back up before you can have sex. So it's just a lot of backup and you have to take it at the exact same time every single day. What's great is drospirenone is the new progesterone-only pill in the United States, also known as Slind is the name brand, and it has a 24-hour window of forgiveness versus the 3-hour window of forgiveness in the standard progesterone-only pill. It comes with 24 active pills and 4 inactive pills. And the negative mainly is the cost. It's $194 versus $16.50 per pack, and that's per month, versus $16, which is Yasmin generic, which has the same progesterone, but also has the estrogen, and therefore is more effective in general than progesterone-only pill. And then if you have any kidney problems, you cannot use this because it increases your risk of hyperkalemia, which means a whole ton of potassium in your blood, and therefore you could have a heart attack. It's okay, though, for smokers and those with high blood pressure, which is usually the people that we put on progesterone-only pills. And then also if you have a bunch of other clotty symptoms like antiphospholipid antibodies with lupus, heart disease, stroke, current history of breast cancer, liver cancer, and other liver issues, then it's also not recommended. Next slide. So there's also a new patch out there. It isn't that new, but what your doctor doesn't know, you might not get. So you may need to educate your doctor that there was a patch out there called Ortho Evra. Then the generic came out called Xulane. And a lot of physicians didn't like it because when we looked at the level in the blood, it was 50 micrograms of estrogen equivalent versus our standard 30 micrograms of estrogen. So that's like 40% more, just a lot more than you need. So this pill was specifically formulated to only give the equivalent to a 30 microgram estrogen pill. So safer, because with the higher estrogen, you have blood clot risk and death. And so doctors don't like blood clot risk and death, and neither should you. And so at 30 micrograms, it was fine. The slight negative is it does cost more because it's brand and it's new. So it's $190 a month versus $110 a month, the generic Xulane. But the generic is crazy expensive because it's the only one in the market. So they still have a monopoly, despite being a generic, versus your birth control pills, which are only $15 a pack per month or $7 a pack for some of the pills. Pandia Health, my company, does have a special with the company. So if you're a cash patient, we can get it for you for $50 per month for the first 3 months. And so far, as long as you want. But at some point, the company might increase the price, or if they get enough people buying it, they may be able to maintain it at that price. The limitation of the patch is if you have a body mass index of 30 or greater, then we don't prescribe it, we don't recommend it because it doesn't work as well, and there's a greater risk of blood clots. And the name of this brand is called Twerla. Next slide. And this is just the geek in me wanting to show the graph. If you look at the spikes and the peaks and the spikes and the peaks and the spikes and the peaks, that's the average estrogen level in the body from a 35 microgram ethinyl estradiol birth control pill. What's most important is the area under the curve. So if you were to take a crayon and color the area under the curve, you'll see that there's a big curve up there with like a EE picograms per milliliter of 80 picograms per milliliter. And that was the old patch. And then you'll see there's a lower graph down there, and that's the new patch. So it just shows you that the area under the curve of the new patch is pretty much the same as a pill and significantly lower than the old patch. So I saw that Ramona had to step aside for a second, but I don't know if I can advance the slide. While we're waiting for, oh, look, I'm able to advance a slide, or he heard me. I don't know which one. I think I'm able to advance slides. Lastly, there is a new vaginal ring. It lasts for a year. I was very excited when I heard this. I was like, oh, all of us that don't have experience putting in IUDs can just do this. And actually, you don't even need a physician to do this. If you're a female and your doctor prescribes this, you stick the vaginal ring up your vagina. It doesn't matter what orientation, as long as it's touching mucous membranes and delivering medications. The only negative is you'll note on the first line, it only has 13 micrograms of estrogen, and we generally recommend 30 micrograms of estrogen until you're 30 years old for your bone health. And so this is a hashtag Pandia public service announcement, or something that if your doctor doesn't know, you're the one whose bones are going to suffer. If you're 30 and above, go for it. Use this. If you're under 30, unless you're large boned and very confident of strong bone density, but scrawny little Asian people who don't have lactose or, are lactose intolerant or just not getting our calcium, this is not a good method until you're 30 years old for the safety of your bones. It's amazing. It doesn't require refrigeration. It is very expensive at $2,500 per year, but cheaper than an unwanted pregnancy, which would be $10,000 for a vaginal delivery, $40,000 for a C-section, not to mention the cost of a child that you don't want to have. The good news is in the United States, thanks to Obama-Biden, any FDA-approved form of birth control should be available with no copay, no deductible, also known as free. But if you have a religious employer such as Hobby Lobby or the Catholic Church, or unfortunately Jesuit colleges like Georgetown or USC or Santa Clara University, they may not cover it. But they might cover it if your doctor writes it's for heavy periods and you're using it to make hashtag periods optional. Next slide. So here's another new one. It's over the counter. They've done some great advertising, and it's an acid contraceptive gel. But to me, it's pretty much another spermicide. Its efficacy, 15% will get pregnant on it versus spermicide, 16%. I find it very expensive at $353 for 12 doses. You have to use a new dose every single time you have sex. And if I remember back to my 20s, I was having sex like 3 times a night when I had sex. So this would be $100 for every single time you have sex. And that's pretty expensive. It has a bunch of acid in it and potassium bitartrate, which is fine because the natural pH of the vagina is acidic. And therefore, it's the acid that's being hostile to the spermicide. However, because you're adding some goop to your vagina and your urethra is right above your vagina, the goop can cover up the urethra and then give you a urinary tract infection. So if you have a history of urinary tract infections, this goop is going to make the situation worse. So it's contraindicated in some people with a history of urinary tract infections. You have to use it at least an hour before, and you have to put a new ampule in your vagina for each act of intercourse. And do not use it with the vaginal ring because the acid will eat into the vaginal ring. So that's not a good thing. Next slide. Ooh, I think I can advance the slides myself, huh? Over-the-counter birth control. Everybody's very excited that birth control in the US of A is going to go over the counter. However, unlike China or some other countries where all birth control pills are over the counter, the United States is going the route of everybody that wants to go over the counter has to apply one by one. So first Pandia public service announcement in this slide is there are 40 different pills out there. So all 40 pills will have to go one by one. And it's going to take $5 million to $10 million each to take them over the counter versus if the FDA just declared, let's send them all over the counter, it would be a great thing. RH Pharma is the first one that got it together to put in the application, and it should be approved sometime in 2023. Maybe March, maybe October, I don't know. But as I mentioned earlier with the new progesterone-only pill, the one that's going over the counter is the old progesterone-only pill. So if you are late taking it by 3 hours, and anybody with a uterus who's ever taken the birth control pill, how many times have you been late by 3 hours? A lot. If you had sex in the past 5 days, you will need emergency contraception. And even then, no guarantee that it will work. It's just backup to prevent unplanned pregnancy. And then you should abstain for another 2 to 3 days, or at least use a condom until the hormone effect builds back up. So again, not a fan of the progesterone-only pill. If you could take it every day at the same time, sure, but not everybody is that anal. And it would not have been my first choice to go over the counter, but it was the one that was available, and it's the one that the company is taking over the counter. My new hashtag is hashtag get the good stuff. If you have access to a physician who can prescribe you the good stuff, don't go for this over-the-counter stuff. I'm kind of scared that when this goes over the counter, every woman is like, all birth control pills are the same. I'm just going to go for the over-the-counter. And they won't realize that this one is not forgiving. You have to take it at the same time every single day. And it won't necessarily have as many benefits as the estrogen-containing birth control pills, which can help decrease ovarian, endometrial, colorectal cancer, as well as maintain your period stable, as well as potentially decreasing your acne better than this particular pill. There is another pill that's applying to go over the counter, and you can see here that I led with 20 micrograms of estrogen. So this has a similar problem to the Anovera ring, which is if you're 30 years or older, go ahead. But if you're 12 to 30, a lot of people, or 15 to 30, don't use this unless you know you have good bone density. But under the age of 30, Stanford Pediatric Adolescent Gynecology, Stanford Pediatric Endocrinology, Stanford Adolescent Medicine do not recommend less than 30 micrograms of estrogen until you're 30 years old. So again, these two things that are over the counter, not the greatest. If you have access to a smart, good doctor, hashtag get the good stuff. Don't go for this over the counter until they give us over the counter stuff that's better. We over advanced the slides. There we go. We want you to get your birth control under control. And so the top 3 reasons for missing a pill. Number 1, forgot. Well, now we have the technology to take care of that with an alarm. Or I have a friend, an acquaintance that has made a birth control holder, which has 4x7. And if you don't punch out that hole for that day, it will keep sending messages to your phone or whatever until you take the pill. So I think that's very, very cool. Number 2 is away from home. So whenever I go travel, I put a pack in my purse, I put a pack in my backpack, I put a pack in my toothbrush thing. And that way, if my luggage gets destroyed, at least I have it in my purse, at least I have it in my backpack. But ask your doctor for an extra travel pack. And if your insurance won't cover it, then I would say, if I get pregnant, I will sue you. But if you don't want to argue with them, it's only $15 or sometimes $7 for an extra pack of birth control. You just got to get your doctor to prescribe it for you. And then no new pack. So as a doctor, I didn't know until I started my birth control delivery company that when I write dispense 1, refill times 12, I gave you a year's supply. What are you complaining about? But I've actually chained you to the pharmacy every single month because the pharmacy cannot expand a doctor's prescription. They can only constrict it. So ask your doctor to dispense 13 packs for a year or 17 packs if you're skipping the placebo. And tell them that they can always constrict the prescription, but they cannot expand it. And by them writing dispense 1, refill times 11 or 12, they've chained you to the pharmacy every single month. And then lastly, get your birth control delivered. The whole reason I created Pandia Health was such that nobody runs out of birth control on our watch, because that is one of the top reasons why women don't take their birth control. And my friend Prolani and I and 4 other co-founders, we will solve this. We will send you birth control and keep sending it to you until you tell us to stop. Though if your prescription runs out, we need you to get a new prescription from your doctor, or you can use our expert birth control doctors in 15 states. And we encourage birth control tourism. Next slide. Great. Know your emergency contraception options and get it in advance of need. Next slide. Cool. So these are the methods of emergency contraception. On the left, going to the right from most effective to least effective. And I bet you if you were to quiz a bunch of doctors right now, many of them would not know that you can use the hormonal IUD for emergency contraception. So if it were me, my daughter, my friend, my patient, anyone listening to this lecture, and you were sexually assaulted and you didn't want any chance of being impregnated by your rapist, the copper IUD is pretty amazing. And it's like 99.9999999% effective in preventing a pregnancy if placed into a uterus within 5 days of sexual assault or contraceptive failure. And they actually did a research study in January of 2021 that was published, I believe, in the New England Journal. And they did it against the hormonal IUD, which had never been tried before. And I actually like the hormonal IUD because it has fewer side effects than the copper IUD. The copper IUD generally results in more cramps, more pain, but you could just throw it up there for emergency contraception and have it taken out after a month. It'd be very expensive. It's like $800 or something like that, but it works really, really well. And it lasts for 10 to 12 years as a birth control device. So, but the hormonal IUD had, I believe, 3 out of 317 people that used it for emergency contraception. And these people had lots of sex. Like normally when we do emergency contraception, it's have you had unprotected sex in the past 5 days? Once. But these people on average had 2+ sexual events in the past 5 days. And they threw these 2 IUDs up there. And the copper IUD had 0 pregnancies out of 300 some odd patients. And then the side that was randomized to the standard hormonal IUD, the 52 milligram IUD, had like 3 out of 319 or so. The second one, if your doctor hasn't been keeping up to date, your doctor may not know about this. And this is prescription emergency contraception. It's called ELA. And the way to remember it is emergency contraception starts with the E, ELA starts with the E. And so ELA is good emergency contraception. It's only available by prescription, but I advise anybody who has a uterus of reproductive age, so from age 12 and a half to 50, 52, 53, 1 year after your last period, you should have a pack of emergency contraception. And I recommend ELA because it beats Plan B and all its generics, which you see in the third column, at every single time period. And it also works up to a body mass index of 35, but Plan B and its generics have BMI limitations, which we'll address on the next slide. And then lastly, you can take a bunch of birth control pills now and a bunch of birth control pills in 12 hours, but that is the least effective method. But if you're stuck in the middle of nowhere and all you have is a pack of pills with levonorgestrel or norgestrel as a progesterone component, that's generally what you can do. Next slide. So this is just showing you the greater amount of pregnancies in blue that you can get with Plan B versus ELA. And I know it's only a difference of 1.6% or 0.8%, but one could argue it's 150% more, or if it's you, it's 100% more. So don't hashtag get the good stuff, get ELA, don't get Plan B. And if your doctor writes a prescription and you have insurance under the Affordable Care Act, no copay, no deductible, aka free. Next page. This is the body mass index. I see so many people very excited and promoting emergency contraception over the counter, and that's great if your body mass index is less than 26. But 66% of the US population has a BMI that's 26 or greater. So please check your body mass index, because if your body mass index is equal or greater than 26, Plan B and its generics are not so effective. And so that is roughly 147 pounds if you're 5'3", 176 pounds if you're 5'9". If you are BMI 26 or greater, consider ELA, which is olapristal, or an IUD. If your BMI is 30 or greater, Plan B and its generics do not work. Do not use Plan B. Use ELA or an IUD. And if your BMI is 35 or greater, your only option is one of the two IUDs. Next slide. So this is, it was supposed to be animation, but it's totally fine. I'll talk you through it. Get emergency contraception in advance. You want to think of it like a fire extinguisher. You want to have it ready at 3:10 a.m. if the condom pops at 3 a.m. You don't want to have to be like, the condom popped. What pharmacy is open? How do I get there? Do I have money? Is the pharmacist going to give it to me because they're going to think it's an abortifacient? Which it is not. It is your last opportunity to prevent an unplanned pregnancy, to prevent abortion. But if you don't have it ahead of time, the pharmacist won't give it to you, it's not covered by insurance, you can't get your money or whatever, then your house will burn down, aka you will be pregnant, and you don't want to be pregnant. So you want to deal with all these issues when you're not in that emergency situation. And at Pandia Health, for all of our patients, we write on the prescription, please give this person the one with the farthest expiration date. And generally, you can get one that doesn't expire for 18 months to 2 years. So again, under the FDA, under the Affordable Care Act, no copay, no deductible. But if you have to pay out of pocket for ELA, it's like $40 to $50. And for Plan B and its generics is about $20. Next slide. So I want people to think about birth control, not for birth control, in particularly conservative states where it might be difficult for this concept, but also in people who aren't using it for birth control. 70% of those with uteri who use birth control pills, patches, rings are also using it for birth control reasons. But what I'm about to propose here is, as a Silicon Valley Asian American mom of 2 teenage girls, is your daughter going to do better on the SAT bleeding or not bleeding? Because I'm betting not bleeding. And my daughter has chosen not to bleed, not to have a 1 in 4 chance of randomly being hit by blood 1 week out of 4 as she takes exams, as she does sports, as she goes into finals, as we go on vacation in Hawaii. These are all bad times to have random blood hitting you. And so no longer is birth control, should be birth control, but it's actually just hormonal treatment. It's estrogen, progesterone pills, progesterone only pills, and not necessarily birth control. And it's to level the playing ground and doesn't have to be thought of as birth control. So I thought I came up with this idea in 2006 when I got pregnant with my first daughter. I realized the only reason those of us with uteri bleed every month is we build up that lining of the uterus up to a rich, thick level, blood level 10, I like to say. And then we're like, embryo? Oh, no embryo. Bleed. And then we build it up again and we're like, embryo? No embryo. Bleed. And we do this every single month from age 12 and a half to 51. And why are we doing this every single month if we're only trying to pop out 2 babies and generally at age 26 or 35? Every time you build that lining, you risk a mutation and therefore endometrial cancer. Every time you pop out an egg, we don't know if it's the popping or the healing, you risk ovarian cancer. And then lastly, the intestine is around the uterus. So my hypothesis is your uterus is going up and down, up and down, up and down, and your intestine is like, oh, I'm sad for you. I'm sorry. And it either runs faster, which is diarrhea, or it runs slower and you get constipation. And so 30% of people with uteruses with their periods have one of those symptoms. And the more times you mess with the intestine, the greater the risk of colon cancer. So people say, well, that's not natural. And my doctor has been telling me I need to bleed every month. Yes, we in the medical community has drilled it in your head. You must bleed every single month. And yes, if you're not on hormonal therapy, you better bleed every month, or I need to check what's wrong. Either you are not enough nutrition, you are pregnant, you have a thyroid problem, you have a tumor in your head. However, if we look at normal human biology, it's actually fewer periods per month. And Dr. Beverly Strassman studies the Dogon tribe of Mali, Africa, where they die at the same time we do. Not like they die at 30 and we die at 70, 80. They die at 70, 80, and so do we. And every time a woman menstruates, she's banished to the menstruation hut. So what she found, dun, 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 on the left is the Dogon tribe. On the right is what we have here at the USA. On the left is natural, untouched. On the right is lots of calories and not so many babies. On the left, they start their periods at age 16 because you need 100 pounds of weight or 22% of body fat. So we have lots of nutrition here in the United States. We start that at age 12. They, not so much nutrition, 7 periods a year. We, tons of nutrition, 13 periods a year. More importantly, they have 8 or 9 children. We have 2 children. How many periods, menstruations do you have when you're pregnant? 0. They spend 12 months exclusively breastfeeding. We spend 0, 3, 6 months breastfeeding. How many periods do you have when you're exclusively breastfeeding? 0. And then TLDR, big summary, they have 100 periods in their lifetime. We have 350 to 400. We have enough for 3 other women, a lot. And they have no endometrial ovarian cancer because they aren't up and down, up and down, up and down, up and down with the lining and pop, 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 pop with the eggs that we are incessantly menstruating here on the right. And they are very often pregnant or breastfeeding on the left. So these are medical conditions that are better with stable hormones rather than up and down, up and down, up and down every month from 12 and a half to 50. Acne, arthritis, depression, diabetes, seizures. If you have heavy periods, if you have painful periods, if you have premenstrual syndrome, if we get rid of period, and menstruation, all those problems are gone. The number one cause of anemia in a menstruating woman, menstruation. And if you have a bleeding disorder, every time you get your period, blood everywhere. Your doctor's not happy about that. You're not happy about that. So this is, an option for those with bleeding disorders. And as I mentioned, it decreases ovarian, endometrial, colorectal cancer, not to bleed every single month or to go on the birth control pill patch ring, which lightens your period. Financial and educational, the number one cause of missed work and school in women under the age of 25 is horrible, painful, heavy periods. And that is not just in third world countries. That's here in the US of A. 10 to 45% of teen women miss school because of horrible periods. And in third world countries, they're banished to menstruation huts. They're not allowed to go to school because they don't have menstrual products, or they're dirty, or they're shamed from their religious participation or political participation. And then the academic competitiveness, I pointed out with the SAT, but me personally, pre-med, MIT, biochemistry final, all of a sudden, blood. And I'm like, do I finish the exam or do I run to the bathroom? And all you pre-health people out there, you know the answer. You finished the exam. But did I feel the blood running down my leg? And was I a little concerned when I finished the exam to run to the bathroom? Yes. And as I looked to my left, I looked to my right, MIT, 2 people without uteri. Not a care in the world. I have 2 daughters and I want them to be on equal level playing ground as those people who aren't going to be randomly hit with blood 1 week out of 4. And then anecdotally, teenage life is already bad enough, and life is already bad enough to have to worry about your period just randomly hitting you, leaking you. When is it going to happen? For those without uteri out there, it doesn't happen at the same time every single day of the week, every 4 weeks. It moves around, sometimes 10 a.m., sometimes midnight. You don't know when or where. And as a woman, we always have to have some menstrual product in my backpack, in my purse, in every single bathroom, and everywhere I go. And if you don't, then you have to take the toilet paper and try to makeshift something sad. And I also do believe that wherever there's free toilet paper, there should be free menstrual products. It's simply about dignity and equality. Lastly, cramps. And then the example I give is the Olympic swimmer came out of the pool 4 years ago and she's like, I think I lost a millisecond because of my cramps and blood loss. And I was like, who is your doctor? Because if I were your doctor, I would make sure no blood loss anywhere near the Olympics. I want no blood, no pain, no distraction. And I also want you with the most hemoglobin in your blood so you have the most oxygen to swim as fast as you possibly can. So all you athletes out there, I hope you're taking note. And environmental. Those of us with uteri use about 10 to 13,000 tampons or pads in our lives. This is just what I dug out from under my sink. Imagine if I piled up 10,000 to 13,000 of these suckers. If we could cut that down by a third or cut it down by 2/3, that would be amazing for the world. And money-wise, costs money. So in the absence of hormonal therapy, if you're not on any hormones, not having a period is a problem. But we have the technology. If you're bleeding every single month, that's so 2020. Get with 2022, almost 2023. If you ask most female doctors, they choose not to bleed every month. And they're just not sharing that with you. I'm sharing that with you. So we now have the technology that you don't have to bleed every single month. If you enjoy bleeding every month, go ahead. But if you get ovarian, endometrial, colorectal cancer, don't come crying to me. I gave you an option. Let's make periods optional and make sure you share that with people. Go to pandiahealth.com/periods optional. At the bottom is the same TEDx talk if you want to share it with other people out there. I'm sure if you share it with anybody with a uterus, it will blow their mind if they haven't heard about this before, and they will thank you for it. And then it's really important right now for people to understand good versus bad telemedicine. Telemedicine 1.0 is what I call fast, cheap, online. But is that really what you want for your healthcare? If it were me, my daughter, my family, I don't want fast. I do want cheap, and I do like online. But as a doctor, I know the limitations of telemedicine. Anyone who's telling you that they're doing primary care online for your annual checkup, how are they checking your blood pressure? How are they checking your heart rate? How are they listening to your heart? How are they listening to your lungs? Are they getting a good view inside your mouth? And as a pediatrician, how are they looking in your ear? How are they palpating your neck for any lymph nodes? Or how are they palpating your breasts for any tumors or lymph nodes in your armpits? They can't. Not on telemedicine, not to my knowledge. A way to check the quality of an online service is, 1, who is their CEO? Who is their founder? Are they a physician? If they're a physician, at least they've sworn an oath, do no harm. Pandia Health is the only women-founded, women-led, more importantly, the only doctor-led company in this space. And I've taken the oath, do no harm. So we will always tell you what's best for your health, even if it doesn't benefit our bottom line. Do they have a chief medical officer or only an advisor? As a startup, I totally get it. You have an idea, you have some advisors, but if you're going to be writing prescriptions for people, if you're going to be delivering healthcare, maybe you should have a chief medical officer and not just an advisor who looks in and checks in upon things once in a while. A chief medical officer is responsible, somebody you can hold responsible, but also somebody who knows their stuff, hopefully. Do they list their providers? At Pandia Health, we proudly list everybody's first and last name, where they went to school, their academic criteria, why they are proud to serve and help women's health. Maybe they don't list their providers because they treat their doctors like commodities, and there's very high turnover because the doctors have seen the way they treat their patients and they don't agree with them, or they're underpaying them, or they're abusing them, or I don't know, whatever. But we have very low turnover at Pandia Health, if any. Are they opt-in or opt-out? And the example I give is female condoms. They may say, oh, do you want some free internal condoms? And you're like, who doesn't want some free condoms? And then you get 20 female condoms. And you're like, what? What is this? And we actually had the female condom company approach us. And they're like, your competitor just made $200,000 on female condoms. And I was like, what? Like, as a physician, I've only seen men who have sex with men use female condoms. Very few heterosexuals use female condoms. So I'm surprised that 200,000 women would request that. But we've seen some companies do that, and that isn't quite right to be billing $200,000 worth of condoms if people didn't truly want or understand what they were getting. For emergency contraception, excuse my typo there, do they just send it to you, or do they make you uncheck the box? The box should be not checked, and if you want it, you check the box. And are they sending you 2 emergency contraception at a time? That is not standard of care. If you barf it and you need another one, they can send you one to your pharmacy. A good doctor would do that. Are they experts in the field? Certainly, I am a great admirer of people, family medicine, who take care of people from birth until death, who can deliver you, who can do surgery. I think that's amazing. But if you can get the best, why not get the best? I would want the one who has only done birth control for the past 6 years, somebody who studies and lives, breathes, eats, and prescribes birth control. How I describe myself, and how is going to happen soon with menopause, but also what experience have they had in the field? Do you want the same person writing erectile dysfunction as writing birth control? 2 kind of different things. Are they academic? Meaning, are they evidence-based? Are they pushing something to you that has not been tested in any trials to be necessarily better than placebo? And so just make sure that you're getting #the good stuff. And then clinical pearls. I realize this is for a lay person audience and not physicians, but if there were any physicians on here, but also as a lay person, I give this talk to a bunch of sorority and college young women, and they'll look at their birth control pills and they'll be like, ooh, I'm on 20 micrograms of estrogen. So anybody on a birth control pill right now with estrogen, check how many micrograms of estrogen you're on. If you're under 30, we recommend at least 30 micrograms of estrogen. If you're 30 and above, you can do whatever the heck you want. But if you're under 30 and you're not on 30 micrograms, it's not good for your bone health. And this is just the research studies showing that those who have 20 microgram pills have lower bone density. And then which progesterone? So as a woman of color, I realized what I was taught at the major academic institutions is great for a Caucasian female that wants to bleed every month. But for Asians, Blacks, and anybody who wants to skip their period, need a touch more progestational effect. And so we found that desogestrel works really well and much better than norgestimate. And then if you fail that, then drospirenone, which is really good for polycystic ovarian syndrome, really good for acne. But you need to be able to drink 8 glasses of water a day, mainly because if you don't, you'll end up with a headache. And then if there were any prescribers on here, this is a link, bit.ly, Pandia Health Androgen, capital P, capital H, capital A, free online list of all the birth control pills from most likely, to make you bleed to least likely to make you bleed, most likely to give you zits to least likely to give you zits. So a very useful reference document. And this is just showing you how I ranked it on this particular one from most likely to give you, least likely to give you zits to most likely to give you zits. And recall that there's 40 plus pills. This is just a highlight. And then a general health, if you are pregnant and you don't want to be pregnant, there's a great nonprofit website called plancpills.org. You can get it in advance of need. As we mentioned, you can only take medication abortion up to 10 to 12 weeks after your last menstrual period. And if you're ordering it, excuse me, from Aid Access in India, it can take 14 to 21 days, which is 3 weeks. So then you need to, get it ahead of time. It's only $110. And so you could split it amongst the roommates of, 4 roommates in a house or in a sorority or in a dorm or something like that. And all of these sites have been tested and are trustworthy. It's run by my friend. It's a nonprofit. So they're just listing. They're not there to make money. They're just here to do good. And next slide. When you Google abortion clinic, 70% of the time you'll be given a crisis pregnancy clinic, which is not a real clinic. They'll call themselves a pregnancy clinic, a women's health clinic, but you go in there, there's no doctor, there's no medical license, there's not allowed to provide any medical care. They'll give you free ultrasound and they might give you diapers and stuff like that, but they will basically lie to you about abortion. They are religious nonprofits. So if you want to go to a place, if you want an abortion, make sure you go #get the good stuff. So these are 2 websites that we trust. The National Network of Abortion Funds, abortionfunds.org, or the National Abortion Federation, NAF. And they have a warm line, prochoice.org, that you can call for any questions about abortion. Where can I get it? I need help, blah, blah, blah. These little purple dots show you abortion funds. If you have money and you want to help people, donate. If you need money for transportation, to take care of your child, to pay for an abortion, etc., that's the number that you want to contact that is safe and that will get you the health care if that's what you need. And then acne for you, Romana. Primary care doctors can treat acne. Proper management can control the disease and limit or prevent scar formation. Non-dermatologists provide less than 25% of acne care, but your primary care doctor should be able to handle 90% of acne. And so that is what we are starting at Pandia Health. We are actually going to cover acne. So if you want good acne treatment, come to us. Or ask your doctor. I just want everybody to understand what causes acne. It's pretty cool from the geek biology side. Number 1 is abnormal shedding of the skin cells. So imagine you have a pore and you have skin cells, and the skin cells are sticky and they're blocking the pore. And so that causes part of acne. Number 2 is sebum, which is oil. We all know about the oil that happens on your face as a teenager. And then number 3 is it's Cutibacterium. It's an adorable name. Cutibacterium acnes, which is colonizing your face. And that's why they use antibiotics or benzoyl peroxide to kill that bacteria. And then lastly, inflammation. So the inflammation example I give is if you cut somebody, some people heal beautifully. Some people heal with a really ugly dark color, post-inflammatory hyperpigmentation. My family kind of runs that way. Some people have big, elastic thing on top that's called keloids. And so depending how you heal, that is going to affect how your body reacts to acne. And then this is the way treatment should be escalated. Over the counter, they have benzoyl peroxide, salicylic acid. Prescription is tretinoin. And if any doctor is treating acne, they should start with tretinoin. If they give you anything less, then maybe you have wimpy acne. But prescription-wise, tretinoin and all the review papers attacks most of the causes of acne, the 4 that we showed you before. It just doesn't attack killing the bacteria. So combining benzoyl peroxide and tretinoin, and if you're doing them separately, you should do them at separate times of day because the benzoyl peroxide actually kills the tretinoin. The salicylic acid actually kills the tretinoin. And yes, so I will do that. And then third is if you have red inflammatory and you need to kill bacteria, then Then you can do topical antibiotics. And then if you have chest or back acne, I like to start with oral antibiotics because the odds of you putting this antibiotic on your chest or back is very low. So, and then if you have really bad acne, we also want to start the oral antibiotics as well. And then lastly, our company will not prescribe you Accutane simply because it's a big hassle and you have to sign all this paperwork and all that stuff. And it's best handled by a dermatologist. But everything above Accutane, your primary care doctor should be able to take care of. So Lena asks, when it comes to a woman's health, what would you say is the biggest priority for women in their 20s? I would say that if you're heterosexually active, don't get pregnant. And number 2 would be don't catch any sexually transmitted infections. Number 3 is, I think right now, mental health is a big thing for a lot of people. As a woman who's had to accomplish a lot in my life, I think many of us have sacrificed have always put others above us or have put work above ourselves. And as I'm getting older, I realize you only live once, but also it's okay to set boundaries. It's okay to say no, meaning I can't do it. I have too much on my plate, or let me refer you to someone else, give someone else that opportunity to shine or to take that place. But mainly the way I've prioritized my life is I make sure that I now block out lunch and that I eat lunch every day. That's also good for obesity. And then for dinner, our whole family, we set aside 7 p.m., which we're about to hit in 3 minutes, where we eat a family dinner every night. Husband, wife, children, we can talk, we can meet, and no, maybe not so relevant, sorry, for a 20-year-old. So a 20-year-old out in the world, make sure you eat, sleep, drink, exercise, and as an obesity person, exercise is can be incorporated. Like right now on this Zoom call, I'm standing, so I'm getting some exercise. But also, if I'm bored during the day and I'm on the computer for 8 hours, I can bounce up and down in my chair and get some exercise. Or I was taught in high school to increase your productivity, 10 minutes out of every hour, you should take a break. So I always look at the clock, and right when it's about to hit 50, I'm like, I get a break. And during that break, you could do exercise. You could dance, you could bounce, you could jump. And then I really need to find a yoga ball sponsor. I really love giant yoga balls. And so the biggest muscles in our body are our quads and our glutes. So if you sit on a yoga ball and you're fidgety, then you're exercising your biggest muscles possible. Priority in terms of acne. So unlike what people have, I forgot to address the myths about acne. One big myth is your face is dirty and you need to wash it more. You do not want to wash your face more than twice a day, because if you wash it more than twice a day, then you strip it of the oil, and then your body makes more oil, and then you get more acne. Another myth is if you eat greasy food, you get acne. If every single time you eat greasy food, you get acne, then yes, you stop eating the greasy food. But the research has shown if we have 50 people on greasy food and 50 people not on greasy food, their acne isn't any different. Or we'd self-test within themselves, it isn't any different. So that's an absolute myth. There may be slight more acne in people who are heavier and who have polycystic ovarian syndrome, and they have shown with like lots of carbs, some people get more acne, so maybe there's that. But in general, 75% of people will get acne in their lives. My other tip is don't pop the acne, because I'm all about like, that's nasty, it's pus, it needs to go out, it's gross, I want to get rid of it, and it hurts. I actually have a cartoon diagram before everybody had their cool cartoon diagrams from Stanford that shows if you pop it, 10% oozes out, but 90% goes in your skin. So what would have gotten better in a week is now going to take 2 weeks because you squeezed it into your skin. So if you're going to pop it, I just recommend generally hydrogen peroxide a needle or flame a needle, de-roof it, and then let it ooze out. But none of this pushing, squeezing stuff, because it will just go in deeper. I do want to congratulate Lena. I hear that you're engaged and you're getting married next year. So I would, encourage considering making periods optional. You can use the IUD, the implant, the shot, though I don't like the shot because it gives you the munchies and it's not good for your bones if you're on the scrawnier side. But you could also use the pill, the patch, the ring, just so you don't bleed on your honeymoon, you don't bleed on your wedding day. Like, imagine 1 in 4 women probably have bled on their wedding day with their beautiful white dress, and they're like, have to deal with it. I guess I was blessed. I was the 3 out of 4 that it didn't happen. Or maybe you're so stressed you push your period away from your wedding. But the question is whether you can escape your honeymoon as well. So that would be my suggestion. It was such a pleasure to see you, Lena. You look brilliant, smart, just as I would expect the daughter of Ramana to be.
It was really nice to meet you. Thank you for the wedding advice.
Feel free to share with all of your friends. Don't have a period on your wedding. Don't have a period at your bachelorette party. Don't do it on your honeymoon. But it's your call. Your call. If you
I'm gonna follow up with you after this about that, because I have some questions.
Yes, I love it. I do see one question. Somebody said natural withdrawal practice during mating. So I do think that I put up the efficacy of the withdrawal method. It isn't that good. And actually, over time, the male adjusts, because if the whole point as a male animal is to reproduce, and if it knows you're always pulling out before it's throwing down 200 million sperm, it will have a little before you pull out, a pre-ejaculate. And there's actually pre-ejaculate or pre-cum, as the layman will say. And they've examined that, and that has 10,000 sperm in 30% of those with penises. 70% have nothing in it, but 30% do. How many sperm do you need to get pregnant? 1. Though usually you need a couple more than that, because some of them will die on the way. Just in the pre-ejaculate. So we teach young people, as soon as the penis is erect, put on a condom, because if you touch that, then you've touched the sperm and you have a risk of pregnancy. So not a fan of the withdrawal method, but certainly if you want to go on the pill, patch, ring and use a condom and use withdrawal, go ahead. But using withdrawal by itself, not a good idea, because eventually the male animal will have premature ejaculation, and that will not be a happy situation later.
Patented designs that can be worn on scrubs, t-shirts, printed on conference bags, and endless other promotional materials. Daily Wear for Medicine is the first ever of its kind to create curiosity in medicine through visual art. We at MedBricks are celebrating unsung heroes of the past who made enormous contributions to the field of medicine through our unique campaign called Daily Wear for Medicine. You can wear it, carry it, and give it.